You know what? I really do think it varies around the world, but I would say over the last few years, when I work with students, I would often say you have to be careful because right now patients are more naturopathic than some practitioners.
Welcome to the Smarter Not Harder podcast, your destination for one-cent solutions to $64,000 questions. I'm your host, Jodi Duval. Today, we're honoured to have Dr. Iva Lloyd with us. Her remarkable journey in understanding disease factors and their energetic patterns has made her a guiding presence. Dr. Lloyd's expertise spans naturopathic medicine, Ayurveda, polarity therapy, and neurolinguistic programming. Graduating from the Canadian College of Naturopathic Medicine in 2002, she's been pivotal in the naturopathic community with a 13-year editorial role. Her dedication extends to research and advocacy, evidenced by authored books and over 50 international presentations. As president of the World Naturopathic Federation, her visionary leadership shapes global naturopathy, including the recent health technology assessment publication. Our conversation explores naturopathy's essence, its strength and transformative potential. Dr. Lloyd's insights on its evolution and interplay of her roles offer a compelling vision of its future. Join us in this enlightening episode as Dr. Iva Lloyd guides us through holistic healing and holistic medicine. Dr. Iva, thank you so much for being on with us today for the Smarter Not Harder podcast.
Thank you for inviting me.
So we are talking all about healthcare, naturopathic medicine, well, all kinds of clinical care for our clients. So I wanted to start with how and what got you into naturopathic medicine? Why did you become a naturopathic doctor?
You know, I originally went to university with the idea of becoming a medical doctor. And very quickly into that, I realized, there's not as much focus on people as I thought. So when I graduated, so I did graduate with a Bachelor of Science honors. And then my background from growing up was in retail. So I was given an opportunity to work with IBM and open 23 retail stores in 7 years across Canada. So I did that. And then I decided, okay, I don't need to know any more about computers. And like the first computer we sold was like a 386. So it was way back when. And so then I left with the idea of doing corporate health and wellness. And I was at a conference in October or November on corporate health. And I was looking at a magazine and they had an application for naturopathic. Before that, I'd never heard of it. So I applied the next week. I was given an interview in a week and I started in January. So it was like a 2-month period of time where I then had to sell my house, decide to go back to school. And it was a second career for me. So then it fit everything I was doing. While I was in IBM, I took over 50 different courses in what I call little stuff, aromatherapy and reflexology and all different aspects of health, looking for what I wanted. I was a nutrition. I had studied nutrition, all these things. And then I just decided, nope, none of it really spoke to me. And then the naturopathic did. So I started and off I went.
You went, sounds like it's meant to be. My goodness.
Yes.
Incredible. So obviously, you have your own practice now. You're CEO of the World Naturopathic Organization, World Health. I did want to talk to you a little bit more about the connection also with our World Health Organization later on, but Naturopathic Federation, should I say, and also has just recently published the health technology assessment for naturopathic medicine. So we have lots to talk about, but tell me a little bit more about your practice and your inclination of seeing different types of clients, and then we'll jump into the philosophy after that.
So I've been in practice for over 21 years. I've always had a full-time practice, despite the board work and that I've done. For the first 20 years, I actually owned one of the largest integrated health clinics in the area. So at one point, I had 5 different naturopathic doctors working within my clinic. So over the 20 years, I've had more massage, traditional Chinese medicine, acupuncture, that sort of thing. But for the most part of it, it was a very full range naturopathic clinic. I had naturopathic doctors that did IV therapy. We did the whole gamut, one who was also an Ayurvedic practitioner. So for me, it was always about having the whole group. And my focus in practice, I always say, has been the extremes, has been assessment. I love assessment. And in assessment, it's both the labs and the energetics. So I do that extreme. And I have, when people say, what do you focus on? A lot of people tend to say women's health or pediatrics or cardiovascular or cancer or stuff like that. I would say my focus is assessment and mental health. And when I say mental health, it's more not so much just anxiety, but it's about how thoughts and emotions affect health. So all the somatic metaphors and the correlation between how your life is mirrored in your health and that aspect. So a lot of people will come to me when they can't make sense of their health. And that's what I love, and that's what I am known for.
That is beautiful. It's something that I haven't heard being put that way before, but it's very much in my practice. I believe that that's what I see. You know, you see someone with a shoulder injury or someone with a cancer of some sort, and you're trying to align where those emotions are stored, why that has manifested in that particular area. And it absolutely fascinates me that this beautiful matrix and it decides to settle there. So yeah, that's a beautiful way of putting it. I love that. So, you know, naturopathic medicine, obviously in Australia, we'll talk a little bit about the differences across the world. But particularly I get asked this question so much. And here I believe we see it, others see it a little bit more woo-woo. And you know, let's talk around that, you know, the differences of where you see why naturopathic medicine, how that fits in with the current health model that we may have right now. And obviously we will dive into where that's going, but let's just paint that picture a little bit now.
You know what? I really do think it varies around the world, but I would say over the last few years, when I work with students, I would often say you have to be careful because right now patients are more naturopathic than some practitioners. And I say that from the point of view that says patients are looking for their health to make sense. They're looking for somebody to do a holistic look at their health, both the mental, emotional, the environmental, that sort of thing. So the idea that naturopathic is more woo-woo it varies by area, but it really is shifting because most people know that if they have digestive issues, it's going to be tied to their health. People know that, I would say most people know that their stress is carried in the body. What they don't know is the degree of it. So people will know that their arthritis is worse when they're stressed, but they don't recognize that, you know what, that might be the most important factor. So that's one thing that I would say is I think as practitioners, we have to recognize the patients who generally are attracted to naturopathic care are intelligent and are generally have done some other work initially. Like people generally don't come to a naturopathic practitioner or a naturopathic doctor if they don't want to change diet. And some people will say, I haven't come back because I'm not ready to change diet, right? So they know there's a whole lifestyle and they know that the naturopathic approach is more about what you change than what you take. So they expect that. So I think that we're at an interesting time in the crossroads for the profession, because I really do believe that a lot of people are more naturopathic in their thinking, even if they don't say that. They're holistic in their thinking. They are looking, most importantly, if we summarize what naturopathic care is about, it's making health make sense. Everybody's health makes sense. And the goal of the naturopathic practitioner is to link a person's life to their health and to help patients understand. And even sometimes when I work with, I remember talking to a naturopathic doctor once, and he was saying, as I get more experience, then my visits are shorter because I can figure it out faster. And I have found the fact that says, okay, that's true, but the length of the visit depends on how long it takes the patient to understand, right? How long it takes them, so that you can tie it together and you can say, this is how all of these are tied together. And you know, when I think naturopathic practitioners get away from some of the labels and they really look at that says, our value, the where we shine is we make health make sense. And it's different for each person. So it's never about evaluating things as good or bad, whether it be salt, whether it be coffee, whether it be, chocolate or wheat or anything. It's not about evaluating things as good or bad. It's about matching them to the person. And and naturopathic care truly does put the person at the center. And people want that. And people are at a point where that's what they're looking for. So if we forget about some of the other labels around it, and if we just talk to the fact that says we put the patient at the center and we make your health make sense for you, everybody gets that.
Yeah.
Right? Everybody. And then it's all about explaining to people that for some people, the environmental factor is the most important. And for other people, the older you get, the more the mind is on lead. So it's like you can't. So I say to people all the time, it's really difficult to tell a 4-year-old to think their way through pain, but it's not difficult to tell a 70-year-old to think their way through pain. So, so it's about we take into the fact that says health changes based on age, right? What's on lead changes based on age. So as long as we stay within that realm, we don't need to even address or deal with some of the concepts about are you woo-woo or is it research-based or stuff like that. Because part of it is that people know that their health is supposed to make sense.
Yeah.
And we have the roadmap.
And you get it all the time, people saying, oh my gosh, that makes sense. Like you've just explained it so well. Now I get that. And you're like, oh, yes.
Right.
And it's so personalized. You can't do the same test for everyone. You can't explain it the same way to everyone. Like you said, it's very individual at each individual level. And that's the beauty of it. That's the magic in the actual consultations with people, and that you're actually getting through at such a deeper level or at a different level. And that's beautiful. So philosophy, and this is what I love about naturopathic medicine, is it's the same across the whole world. We've got our set philosophies. We teach them in all colleges, everywhere in the whole world. So talk us through naturopathic philosophy, and we've touched on it already, but for those who are not familiar with it or have not heard about it before.
So there's three different aspects to what I would say is the naturopathic foundation. One is the philosophies of vitalism and holism. So vitalism really is based on there's innate ability in the body to heal, or there's innate ability in the body to, I'm going to say, not only to heal, but to work together as a unit and to function as a unit. So the vitalism aspect. And that's really the connection with everything else that's living, right? And then you have the holism. And the holism really is, one, the body has to work together as a unit. So systems theory and everything is connected. Two, you have it where there is no separation between the mind, the emotions, the physical body, the structural body, and the environment. And not only the environment, but culture and what's going on and all of that aspect. So holism is really important. So those are the philosophies. When we look at the principles of naturopathic medicine, where you have, do no harm, which is similar in every system of medicine, but the ones that really stand out for us is treat the cause. And some of it is looking at the fact there's always a cause. There's a difference between we can't always find it because we might not have the right information, but there's always a cause. And when you start with that and you teach patients the fact there's always a reason, right? And then because the goal of the naturopathic doctor is to give people the range of reasons. So let's rule out the genetics and see whether or not that makes sense. What's your family history? Let's look at lifestyle. Let's look at environmental factors. So when you start with the idea, there is always a reason, it helps guide the practice, and it gets so that people trust their health. When there's no cause, people don't trust their health. Things aren't random, right? And that's really important. The other one is treat the whole person, goes along with holism. And when we're looking at one of the other principles, which is the role of the naturopathic doctor is to teach and is to really help patients understand this is what it means to have a healthy lifestyle for you. This is why this is important, right? And it's about recognizing that it is about what you change, not what you take. right? So we have this, and we have this concept also of wellness versus well-being. So wellness is the fact that, so you have a difference between what does your blood work say when we look at you, can we say you're healthy or not, versus at a mental, emotional, spiritual level, how do you feel, right? And that's where you can have people who are in palliative care who feel well, right? You can die gracefully, you can have that. And it's about recognizing all those factors. So we have the principles that guide naturopathic care, we have the philosophies, and one of the other main principles for naturopathic is the healing power of nature. The body knows how to heal. Even if you think about conventional medicine, we often think that conventional medicine doesn't incorporate that, but they do surgery and then they send you home to heal, right? And it's like, okay, now it's up to you. So, we just look at it and say, let's question whether or not you needed surgery for certain things, right? But it is this whole fact that says the body knows how to heal. I was at a seminar with a naturopathic doctor who focuses on oncology, and we've always had very interesting conversations. And he was presenting and he was saying that cancer tumors have 3 times the number of cells to help heal from cancer than they do the cells that destroy cancer. And even in new research, they're finding the fact that the body knows how to heal. Trust it. Trust that, right? And then the goal of the naturopathic practitioner is to say, what obstacles do we need to remove so the body can heal? And sometimes the obstacle is the willingness to heal, right? And sometimes it is the fact that says that, and this is where with patients, the healing sometimes gets stuck because for some people, it is about helping people die gracefully, right? It is about that. So we need to have a broader sense of healing, because for different ages, there is, like, as you get into 75, 85, 90 years old, we're using that word differently. We're using that says, how do you live gracefully? How do you die gracefully? It's about being in sync with every phase of your life and knowing what that looks like. And even as practitioners, you're not going to tell an 80-year-old who has advanced diseases that you're going to heal them. Right? You're going to tell them the fact that says, this is what we're going to do so you have the highest quality of life. But it's that fact that says, even in the dying, the body knows how to do that properly. And our goal is to support that. So it's recognizing from a naturopathic point of view. And when I say to practitioners, if you want to know whether or not the way that you're thinking is correct, look at animals and look at plants. And to say, because we follow those same laws. So they will give you the guidance as to how things happen, right? And how things go. The third aspect is what we call our theories. So it's like the therapeutic order. There's an order in which you do things, right? Which is why we say, if for a chronic condition is do diet first, do diet, do lifestyle, do posture, do all these other things. Like there's an order in which you have to do where the body heals, where we're looking at the body heals in reverse order. So if you've had a condition for 25 years and then recently you have an acute infection, you have to do the infection first. You can't do what's deeper in the body, right? So we have a lot of it is this understanding of how does the body work together as a unit, the whole systems theory. Like when I talk about people, when there's a car accident, for example, you have to know what's on lead. Just because there was a car accident, it doesn't mean the structural body's on lead. It could mean the mind is on lead. Could mean the person can't get out of that shock, right? Sometimes you need to do the mental first. So it's that whole aspect where you recognize the body's a unit and you recognize that structure can override the mind and the mind can override structure, and both of them can override function. So, that's what I'm saying. I generally, sometimes practitioners of all descriptions put too much focus on the functional body, but it's like, you got to keep in mind, the bookends, the whole psychological, the mentally emotional, and the structure, they're going to override, they're going to have a huge impact. And all of those are that theory where we look at health from the point of view that says, it's like a Rubik's Cube, right? You have to figure out how to unwind it in a way that works for that patient.
Absolutely. And I think that's challenge for a lot of people to understand is this, energy moves matter, this ability for us to think a certain way, and that is the roadblock. That is the part, you can work so hard at testing and looking at this particular function, and you can work with the herbs and the medicines and nutrients, but if you forget about the mental aspect or the emotional aspect that's actually moving and shifting or holding or the actual roadblock, then nothing's going to change, and you're just constantly pushing up against a barrier. But for, I feel, conventional medicine, it's a hard process to move through, because there's the different ways of teachings, obviously, the different education system, I feel, and it is very hard to, without understanding themselves and having to go through that or have gone through that, then, that for me is tricky to explain. And I think for many other naturopaths, how do you navigate that, particularly, where you are? Is there any strategies that you put in place or anything that you think about there?
Well, I often will say to patients when they will say, my medical doctor has said this, like, this is chronic, this isn't going to change. And I will naively say, well, did they ask you about your diet? Did they ask you about posture? Did they check your breathing? Da, da, da. And when they say no, 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 and I say, well, if you don't change any of those, it won't change. So you bring back some of that logic, and to say the fact that says that left on its own accord, if the body's out of balance, left on the own accord, it will get progressively worse. But if you change these things, then it won't, right? And people, like, I will do breathing exercises with people, and I will demonstrate to them the fact that says, yes, your breathing is blocked, or you're breathing backwards, or different things like that. Or we will go through diet, and I will, so I do a lot with the basics, because you can never get away from the basics. Although as an experienced naturopathic doctor, you would like to sometimes to say, okay, I've done enough diet. You never do enough diet, because every patient needs it, right? So, but part of it is, it's always about never making the other practitioner wrong, but recognizing the fact that says they're right when you look at this window, right? If you look at it from this window, then it changes. And the other thing that I will always do with patients is I will look at one aspect of their symptoms, and I will give them something that they change more so than take. And I will say, do this for 10 days or for 2 weeks, not 2 months, a short period of time, and see what changes. Because the main thing that patients relate to is the fact they do something and it changes. So when you give them, it doesn't matter whether it's about remove this food. I'm more for introducing foods. Most people are deficient. So there's a rule in energetics, which is you always treat the deficiency first. So if a diet is deficient in vegetables, heaven forbid, most people are deficient in vegetables or in hydration or things like that, then I will do that first, and to say, what do you notice, right? Or if we're looking at, so that's what I'm saying, is that you simply acknowledge that what they heard is correct under the premise of what they were told, and you say, we're working under a different premise. So it's just like, and you pick something easy. Like if somebody says, I always have diarrhea, and it's like, well, if you're intolerant to dairy and you eat dairy every day, you're always going to have diarrhea. So let's cut it out and see whether or not it changes, right? So that's what I'm saying, is that the naturopathic doctor is an investigator. Like the more that you can be correct. So this is where it's important for a naturopathic doctor, when they recognize the body always makes sense, right? So if you're looking at the fact that says somebody has diarrhea, how many options do we have, right? They're eating a food that causes them their diarrhea. They have an infection, right? So there's a medication. So once you have that checklist that says, okay, there's 6 different reasons, we're going to go through each one of them systematically. And it will always make sense, because let's say, for example, if you're saying, if they don't eat dairy, there's a good likelihood it's not the problem, right? And I will often use humor with patients, because it's like, we have 6 things that we can analyze. And, if there are lots of medications that cause diarrhea, or And if you're not on any of them, then we don't need to worry about that. Like so you start with like a mind map. So I do a lot of mind mapping, and you cross things off. So because then people understand that, right?
Yeah.
So that's what I'm saying is I seldom, can't say never, I seldom make medicine wrong, conventional medicine wrong, but I explain the fact that says under their mindset, they're right. We have a different mindset.
Absolutely.
So
Different
yeah,
window, different way of looking at things.
yeah, yeah.
So patterns in your patients. I just want to move into that. Like, what are you noticing over the years? Massive practice that you've had already. What have you noticed on the trends, and what at the moment is the most pressing issue, if anything has changed? You know, it may have stayed the same.
You know what? The most pressing issue that I have in where I am is Canada has the highest number of affluent people that are malnourished of anywhere in the world.
Oh,
So we have one of the biggest trends right now, which is dangerous, is intermittent fasting.
yeah.
I'm not against intermittent fasting, but people miss the fact that says the main aspect is intermittent. So if you don't have any body fat, if you don't have, like I say to people, you can do intermittent fasting if you have 30 pounds or more to lose.
Yeah.
Or if you've, had a weekend where you overdid it. There was a wedding, you were out on Friday, you ate too much on Saturday, there was a reception on Sunday. By all means, on Monday morning, then skip breakfast. But when you have all of these people who have low body weight, like people don't understand the connection between reserves, right? You need to have reserves, and hormones. And looking at it from the point of view that says your hormones are your reserve. And if you are eating less than you need on a daily basis, so let's say 1,800 calories, most people don't need 25 unless you're a bigger guy, but let's say 1,800, 2,000 calories a day. If you're not doing that, you're using your hormones as an energy source. So now I have so many men and women who in their 40s and 50s have hormones like they should be in their 60s. And it's like, guys, this is not okay. Right. So the other thing is that with the introduction of Wi-Fi, the body needs animal fats and minerals to acclimatize to the Wi-Fi. So people don't understand the fact that says the goal isn't to necessarily get rid of Wi-Fi. That's not going to happen. But we have to look at it all through history. We've had to acclimatize. So when there is a new threat to the body, just similar to the point that says if you get a new job and this is the exposure you have, how do you acclimatize to it? How do you adjust for it? So we have this whole change to Wi-Fi, and people have very little understanding of the fact that says you have to increase your body fat because that's how you buffer it. You have to increase minerals. So the more toxic the world becomes, the more you have to buffer it. And buffering it is always about protein, fat, and minerals. And people don't get that. So now we have it that people are aging significantly faster. So we have three things that I see. One is it's crazy when 40, 50-year-olds are malnourished, and they don't need to be, right? Economically. Then we have the fact that says people are aging way too fast because of not only because all of the environmental threats that are affecting them, because they're not buffering it, right? Then what we have is we have these young people, like we are setting people up for Alzheimer's, right? Between all of the Wi-Fi stuff, the earpods, the all of this stuff, we younger people, like when I look at blood work, I would say 60% of the people under the age of 30 that I do blood work for are borderline diabetic. It's like, guys, this is crazy, right? So you can't, and the other thing that is a huge, huge concern, even more so than intermittent fasting, is all of the soda stream and Perrier's and carbonated drinks and all the rest of it. It's like, if you are having a steak dinner and you want something to drink, by all means, have some carbonated drinks. Don't drink water because it dilutes the stomach acid. But carbonated drinks weren't meant to be you weren't meant to drink them all day long, right? I think that is so dangerous for the pancreas, for the kidneys, for the bone. So this whole idea that says people are using carbonated drinks instead of water, not okay. Not okay. right? So there's a lot of changes in the last little while that are significantly concerning. And it changes. Like, I think naturopathic doctors, we need to do a lot of education on the fact that says, you know, this is, like I say to people all the time, this is the purpose of coffee. It's a digestive aid.
Mhm.
If you're having a big breakfast and you can handle coffee, by all means, have a coffee, right? But because the other trend that we see, so many hormone issues in young people. And at conferences, they will sometimes call them Tim Hortons syndrome or Starbucks syndrome, because you should not be having 13, 14, 15-year-olds having these caramel macchiatos and these, you know, caffeine drinks. The body's not ready to handle caffeine until the age of 25, right? So you have all this sugar and all this caffeine way too young. Lots of problems. Another problem that we're seeing is you have young people doing weightlifting before their veins are formed, right? So the body isn't like, you can't have, I'm going to say, you can't have 12-year-old, 13-year-olds doing weights like bench presses and stuff like that. It's like, not okay. They're going to blow their veins in their legs before they have tone. So that's what I'm saying. There are lots of problems. And there's lots of changes. Like, from a blood work point of view, I've never seen ferritin levels as high as they are.
Yeah.
Thrombocytopenia is through the roof. Like, we have, I talked to the lab companies, because since I've been in practice, they've increased the reference ranges for liver enzymes 3 times.
Really?
And they keep saying it's because the levels are going up. So when we're looking at it, it's like, guys, the world is getting more unhealthy. And yeah.
I love that. So I'm going to follow up on a few points there just to clarify. So this buffering, this is very interesting. Obviously, there's a huge component of Wi-Fi, lighting, blue light, lack of sunlight, lack of nature, you know, lack of living how we should. This buffering really interests me. So is there anything that you look at in terms of a certain body fat percentage because of those hormone productions, or is it just an actual nutrient capacity of the body to have on top of that?
You know, I think it is important as a naturopathic practitioner to know to assess the difference between calorie deficient and nutrient deficient, and calorie excess and nutrient deficient, right? So it is about nutrient levels more so than just body fat. There was research that was done early when I was in practice that showed that people had a better quality of life when they got older if their body fat was a little bit higher. But it wasn't really promoted, partly because it was a US study, because of the obesity rates in the US.
Yeah.
Right. So you have it where people right now, there's a lot of promotion on lower body fats. And it's like, don't do that. I think if people stick to like 20-25% body fat, it's fine. Right. You don't need to be, it's not about being obese. It's about having some body fat to buffer it. I think practitioners need to know the difference between estrogen excess and body fat, because too much estrogen feels like glue when the body looks like it has fat, but it's really estrogen. So that's where the knowing how to assess it properly. But, you know, some of it is, it's like with anything. When you have somebody come in and because the main thing that Wi-Fi does, and there's many symptoms, but the main thing it does is dehydrate the body. Like, that's the main thing it does, right? So you want to be able to take a look at a person's symptoms. And it is, for me, it's that mind map that says, I've ruled out diet. I've ruled out, you know, too much exercise. Yes, they're drinking water, that sort of thing. So then you go through, and then it's about, you know, how much time do you spend in front of a computer? And by all means, how many computers do you have around you? And do you use earbuds? And if they come in and they have like 2 cell phones in their pockets, and like, you get a sense very quickly, an Apple Watch on their arm, and, you know, all of these things. It's, as soon as you see somebody, you can often, when they are, you know, it's funny when we talk about patients undressing for an assessment, undressing now means taking all the gadgets out of your pockets. So so you get that sense, right? So, but it is the fact for a lot of people, it is about assessing that. Like, I remember about a year ago, I had a lady come in. She was like 62. And all of a sudden she was dizzy all the time. She had vertigo. She said, like, I can hardly stand up. And this was at during the pandemic. Well, what happened is that because she couldn't get out and socialize as much, her family bought her an iPad, right? So she walked around all day long watching movies. So it was on her all day long, right? And because often it's, when, as a naturopathic doctor, the best question we can ever say, when did it start and what changed? Because when you go with everything as logic, it's like, if you were fine up to this point and then it changed, something is different. So you go through the list. Was it food? Was it exercise? Did you move? Was there a stressor? Now it's about, what did you put on the body? What are you doing different? So you just have to add it to your list of questions, right? And then I had her stop, and in 3 days it went away. And it's like, you can watch a movie, but it can't be on the body. Like, right? And nobody needs to watch 8 movies a day, right? Like, it's just so, and she was watching, she loved movies. It was a new thing for her. She had Netflix. And do you know how many movies you have access to on Netflix? I think she wanted to go through them all. So, but it's still the fact that says there's so many times when I work with people where it's like they can't acclimatize. One of the things initially when the Wi-Fi came out and the Apple Watches, the concern was that it would cause blood pressure to go up. But for a lot of older men, I find it drops it dangerously. And so then again, it's, you do the test. Do 10 days where you go without it and see how you feel. Take your blood pressure, then put it on. So that's what I'm saying, is that a lot of the things that a naturopathic doctor is going to say to patients is easily, quote, proven. If I'm saying your Apple Watch is dropping your blood pressure, you go without it, you take your blood pressure, you put it on, you take your blood pressure. And so if I say, if anybody who has hypertension, I always have them test the reaction to salt and the reaction to caffeine on different days. So therefore they know if you take your blood pressure and it's fine, and you have a coffee and it spikes, coffee spikes your blood pressure. It's a genetic thing. If that happens, it will always happen. So that's what I'm saying, is that naturopathic care works because it's not based on trust per se. It's, you do this happens. It's like with someone who's intolerant to nuts that cause them a rash. You don't eat it, you don't have a rash. You eat the nuts, you have a rash. The nuts cause the rash. So there's a logic to it, and patients get that, right? But people need to buffer. People need to recognize Wi-Fi. You have to buffer. You have to buffer. Sometimes for me, because I like having a really good sleep, I actually had somebody come in who assessed my house. We painted a black metallic paint on the walls, that is grounded. And so there's lots of things you can do to really limit it, depending on how susceptible you are, or depending on how much that bothers you, right? But the one thing I say to patients all the time, trust the body. The body will never lie, right? So it's hard to convince somebody to jump through hoops as far as cutting off the Wi-Fi at night and don't having it on the body if they don't have any symptoms. But if somebody has symptoms that don't go away, they're much more likely to do that. And then the only difference is how much buffering you have to do for each person.
Absolutely. I did a wonderful podcast actually a few times with Nicole Bilgeman. So she's a building biologist and she runs an environmental college over in the eastern states. And yeah, she talks through so many practical measures, but environment and just actually checking the environment properly within a patient's home is key, because it can be, like she gave the example that there was a young patient of hers that had huge allergies and there was an aviary in their room. And to remove the aviary, the problems go away. So it can be that investigative component that really gives you big clues, and sometimes they don't even think anything about it. They have no idea.
That's what I'm saying. You always say there is a reason. If you go with that, you sometimes end up going deeper and deeper into your investigation. But that's the whole thing from a naturopath. When a naturopathic doctor embraces that and hangs on really, really tight, they're always going to be successful.
Absolutely. in the young, in the young at the moment, I would say that there is, for me, a big trust that I've noticed with people. They're losing trust with their body after this huge pandemic. I feel that they lose trust in their own immune system. So building that trust again in my practice, I've had to do a lot of that. But also seeing a lot of technology through children, now wearing Apple Watches and having ADHD-like symptoms. Remove the watch, remove some of the technologies. Poof,
Right.
Increases. It's so simple, yet it's just not common sense. Because that's how we've been driven with the way the world is moving so fast. So very interesting.
Yeah, when things are ubiquitous, we tend to just take them for granted. And then that's where I'm saying it's a lot of it is about slowing it down. And a lot of it is about teaching people the fact that says everything in your environment makes sense. So, and when you bring in nature, that is a good bridge to the point that says, when you think of your environment, this is what nature does, right? This is what nature does versus this is what, busy traffic's, all the rest of stuff does, right? Is that, so there's a different impact on the body. And even just having people witness that and say, how does it make you feel? And then looking at it from the point of view of, even from a clothes point of view, is that we wear certain fibers and we wear certain clothes because of how they make us feel. So when you can bring it to something that people really relate to, then they get to understand the fact that says everything impacts you to some degree. And the whole idea is to live consciously, where you choose things consciously because that's what you want, right? And that's when you can look at it from a food, from a clothing, from a environment, from an activity level. Even, for example, most parents are going to understand if your kids watch a lot of violent shows or violent games, they're going to be more violent. Research shows that, right? So then it's just looking at the fact that says, just keep that in mind, right? And people, I encourage people to learn about mindfulness more so than meditation, because it's like, recognize the energetics of everything around you. And that helps.
Absolutely.
Yes.
So I really want to talk about, just before we move on to the Federation and talking a little bit more about that. But talk to me a little bit about, a mutual friend of ours, Danielle. She said, ask Dr. Iva about how you go through the assessment process, obviously, but also deciding what to do first. And we have talked a little bit about this, but you're known for your assessments. I just wanted to give a little bit more detail before we move on and we miss out on that part.
Okay, so when I meet a patient for the first time, I have a short 25-page questionnaire, which takes somebody about 2 hours to fill out, which I ask them to fill out ahead of time. Part of that is so that they can walk through their health and think about things they didn't think about, right? And it gives them an idea of what I'm going to cover. So it asks about their home environment. It asks about everything from tattoos to smoking to, systems. So it gives them this idea that says, we're covering all of this, traumas in your life, that sort of thing. And then when they first come in, I start with, tell me about yourself, and to get an idea of what a person puts on lead. So I listen to that. And what I'm listening for predominantly two things. I'm listening for when their affect changes. So there's lots of things that people will list, and you can hear a change in the affect. And I'm listening for what I call mental linking, what they link together, right? Ever since I got married, this happened. Ever since the pandemic, this happened, right? So, or because this condition is chronic. So I'm listening for how they link things. So then when they go through, and when I go through the questionnaire, sometimes when I just talk to somebody, if there's a huge emotional trigger on lead, I might only do that in the first visit. If we go through their story and it's not emotionally charged, then I go through the questionnaire. Yeah. And again, I'm looking for what jumps out at me. Some things are just, no, I don't smoke, or, if they say, yes, I smoke, then it's like, how much? Because da, 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 da. So I use that as an indication. And people will unconsciously expand on things that are the most important to them. So if the 8 lines I have for what are the traumatic things that have happened on your life is too short and they're right all over the back, that's important, right? If they really say nothing, They might be blocking it, maybe, but not usually. But then you go through and you really get an idea as to what's important for that person. As a naturopathic doctor, you have to know that whatever happened last is most likely to be on lead. So part of it is that. So I say to people, even from an emotional point of view, if we know that you have a whole bunch of emotional events or traumatic events in your life, until they're on the surface, we don't deal with them, because then we're pulling it up through all these other layers, right? So what I listen for is what's on lead, and it's really has to do with because a person will mirror it based on how they speak. They'll mirror it because, and again, a lot of it is about the affect and about when they talk about it, how much energy is in that, right? So I will look at that. From a when we look at, some people say you always treat the immune system first, you always treat this first. I look for generally the deficiency. The more that somebody's in the transition of life, especially in perimenopause, andropause, stuff like that, then because we shift from a metabolic point of view from healing to maintenance, right? Then I will look for blood work. So the more that people, which is true for a lot of people, the more that people lack a structure to understand their health and to trust their health, the more I give them a structure. First, we're going to do blood work to check out the functional body. We're going to see what's going on there. We're going to do that. Then we're going to do lifestyle, that sort of thing. Once we do the functional, we balance that. We're going to do the hormones, unless they're on lead. So part of it is, some of it is very much about structure. I have a tendency when I treat is I do one thing in depth. So it doesn't matter if I'm treating arthritis, mental, emotional, cardiovascular, I will do something structural, I will do something functional, and I'll do something psychological. So seldom, unless somebody has a strong vitality and we're tweaking, seldom will I give somebody multiple things to do in multiple systems. Because especially if they're deficient, because you have to conserve how many things you have the body to do. So then I will do that. So I'm listening for excess versus deficiency. I'm assessing the stage of life and determining what's happening in the background, more or less. I'm generally always giving somebody a structure to view their life. Sometimes I will use analogies. So one analogy I will say to people is like, life is like a 4-lane highway, 4 lanes, and that you have choice, and then you have the rough, and then you have the ditch. So especially if people are in the ditch or in the rough, and I would say, right now you're in the rough. Yeah. Right? So you get to have choice, but the universe decides the twists and the turns in the road. So, and the universe always wins. So you have to follow that. So then it really is about, I think what's really important as a practitioner, you have to have an idea of how a person sees their life. And if they don't have a good roadmap, the first thing you have to do is give them a roadmap. And I do it through analogies. I have a lot of different analogies. I do it through analogies. But that's the first thing. So, and then the other thing is, even when I work with other practitioners, the mistake I would say that some practitioners do is they say, oh, all these things are going on and they want to do everything. It's like, pick a system. Pick a system that is influencing the other systems to the greatest degree, right? And go deep. And sometimes you are intentionally, like if somebody comes in and they are in extreme pain, and even though there's other stuff, if the pain is impacting their ability to move forward, we'll do pain. But I always do psychological, functional, and structural. Right?
Yeah.
So, yeah.
And I like what you say about, the roadmap as well, but it's making it clear and less muddled in their head of where the direction is. And it's very much aligning that leads them into not feeling so confused about everything that they need to be doing. And better outcomes, I think.
And getting so that they trust the blood work and they recognize the difference between, because a lot of people will come in and they will have a whole, I Googled this, I Googled that, this said this, I believe this. And some of it is looking, saying, okay, any test we do for you is more important than anything you read as a generality. right? So I had a discussion with a patient on the phone where she was saying, I think I have a diverticulitis attack. And she's going through and said, no change in bowel movements, no gas, no bloating. And I said, like, why do you think it's that? Like, it doesn't make any sense. And she says, well, I Googled it and that's exactly where the pain should be. And I'm thinking, I think it's a kidney stone, like just based on what's going on. It's like, so that's where some of it is you are often fighting the perceptions that people have, which generally can get them very confused, right? And even like when I'm saying to people, yes, I know people say intermittent fasting is wonderful, but not for you for these reasons, right? Or, that sort of thing. Or so, for example, when people come in, and especially men, when they come in and they have high ferritin levels and they decided, their family decided to be healthy and they went vegetarian and they're eating legumes, it's like, oh my God, you can't digest them, right? You have to go back to meat. Like, so that's where I'm saying it's always this dance between the objective and the person. And it's about teaching the person, trust your body, trust the labs.
Yeah.
And it's really getting people focused on what is right for them. And you have to get away from generalities, because they get the patients in trouble and they get the practitioners in trouble, which is why, other than maybe for some acute conditions like a sprain or a fracture, naturopathic doctors can't use protocols because, there is, if we take hypertension, for example, there's 9 different reasons why you're going to have hypertension. You can't, right? So that you can't have a protocol that addresses it. So it really is that understanding when people really do individualized healthcare, they always look for the cause, and they treat the whole person. And the whole thing, what do you do first? You excess versus deficiency, make sure they have a roadmap and start with what they need to change, and then be very clear. Like when I work with somebody and we're debating, is this candida versus is this infection? Let's say, for example, then I don't give them both. It's like, okay, we're going to do everything based on it being candida. And if we're right, it will change. If we're not right, it won't change, right? So that's what I'm saying is the clearer a practitioner is in the messaging to the patient, then the easier it is for everybody to figure out what's going on.
Absolutely. I had funny you mentioned about the cardiovascular, but I had a client, it was actually just someone off the street walking today, and they asked me, they looked at the range of herbs I have on my wall and they said, so which one's good for cardiovascular health? And I'm like, and I said, well, why have you got issues with the cardiovascular health? Oh, I've got calcification. Okay, so why is the calcification there? So, stepping back through all these things, and they're like, no, but just tell me which one's good for cardiovascular health. And I said, but it doesn't work that way. We have to know, we can't just throw something at you, like that's not what happens. So it's really that education, and I find it quite comical, but I also get a little bit annoyed at the same time, because it's like, there's not just one fit fear, and it's not just as a blanket cause, like hawthorn is great, but there are other things that we can be doing. So before I move on, Dr. Iva, I just wanted to talk to you about, is there anything that, you don't go for herbs first, you go for nutrients first, or you go for, more energetic medicines first? Is there anything like you have in terms of set approach, or is it just as suited for the person?
A little bit of both. If I look at it from the point of view, so I say to patients, nutraceuticals, vitamins, minerals, fish oils, all that, nutraceuticals treat the body, work from the point of view of the body having physiological pathways, and it treats the physiological pathways. Herbs, gemmos help the body build. So nutraceuticals can't help the body build. They help the body function based on physiological pathways. If you're deficient, you need herbs. Homeopathics help the body when it's stuck. So if you're blocked or if you're stuck, then homeopathics work. So part of it overall is the fact that says that sometimes I will do all of them, depending. If a person isn't stuck, I don't do a homeopathic, right? Unless I'm using a tissue salt to help them build blood or something, right? Or different tissue salts for blood sugar, unless I'm using them as cofactors, right? So there is a logic, is that if somebody's really, there's so many times I work with people that are deficient that come in and who have like a suitcase of all these supplements, and it's like, you can't build when you're deficient based on nutraceuticals. You have to move to herbs. So part of it is knowing when to move to herbs. Part of it is knowing that the energetics of that. the more that somebody understands vitality, understands energetics, then the more I will use energetic therapies. So I will do that. The more that somebody's talking to themselves, self-talk is getting them in the trouble, the more I will do that. So, because I do a lot of work with people on figuring out who they are, on changing how they perceive things, changing how they talk to themselves, that sort of thing. So I will do a lot of that. But I tend to spend the majority of the time in a visit on the psychological aspect and the structural aspect. I do a lot of physical work. So I will do that. But I do targeted physical work. Like a gentleman came in yesterday, he was seeing a great massage therapist, but he still had pain on the tensor fasciae lata. So one of the things that we noticed is the vastus lateralis was, he had a strain. So then I do very targeted work to release that, right? So I seldom will do hour-long treatments, but I do a lot of target work for work that other practitioners might not do, like deep in the throat or, the jaw or something like that. So I will do that. Or energetic. If I'm really having a difficult time assessing what's going on, I'll do it energetically, because I'm also a polarity practitioner. So you want to I think if you know the energetics of all the different tools you have in your toolbox, you'll know when to use them, right? And that's the whole thing. So there is part of it's matching it to the patient. Some people don't like a certain thing. Some people just say, I never react well to herbs. I always react. So we stay away from that, right? Other people only want homeopathics or don't want homeopathic. So there's a little bit of that, but the practitioner always has to say, like, let's say, for example, if somebody's really iron deficient, yes, I might give them ferrum phos to help them build iron, but I'm also going to give them iron, or at least change their diet so iron's in it. So you need to know, right? Gemmos have more of a vitality than herbs, like it's because they're made. So I think it's important for practitioners to really understand the energetics of all the different tools and then to apply them because it matches to the constitution of the person. If you are saying if you're saying the fact that says this person is really lacking yang, or sort of thing, then choose supplements, and choose a treatment plan that is more yang, right? Even if we look at exercise, if somebody is overly sedentary and stuff like that, and you're not going to give them yoga, right? Like, so everything, like when you look at that excess deficiency, when you look at that yin yang aspect, whatever energetics window you have, whether it's food, whether it's exercise, whether it's supplements, match it. And that's what you want to do, is you want to match it.
Makes so much sense. You make it so easy to understand, Dr. Iva. I love it. So I don't want to keep you too long, but I do want to dive into a little bit of the World Naturopathic Federation. So why, how did it start? I love it. And then talk me through this extraordinary HTA. So the Health Technology Assessment, because, oh my goodness, like I haven't made my way through it just yet. And we've been trying to grab it off Danielle to have a look through it. So talk us through all of that.
So there were many times in the past where the naturopathic profession tried to come together, and it happened to work in 2014. And since then, the first thing that we did, so the first executive or board covered off 5 different world regions. So that was the idea. Our first job was to get a landscape of the profession. What is the profession? There was a lot of misconceptions about how the profession was practiced around the world. So in the first 5 years, we did 7 international surveys of the schools, of the associations, of the practitioners. And we expected, as we would go along, that says, okay, this is, quote, the problem, this is thing. But the deeper we went, the more we realized, you know what, the profession really does work very, very similar. Like you said, the principles are practiced in every school, right? So the degree of consistency was much more than we ever imagined. John Wardle, who's from Australia, he recommended that we do the HTA. And what is unique about a health technology assessment in HTA, what's unique about a health technology, you can only use research that is done by the profession. So you can't use what's called borrowed research. And health technology assessment is geared to give governments the idea of what box you fit in when you're being regulated. So, for example, you can't say we're experts in autoimmune disease if you've never researched it. So the first step was to do what's called a bibliometric analysis, which is where Daniela Brown had helped, and to say, let's figure out how much research is done. So when we did that, we ended up finding that the naturopathic profession was very prolific in writing, in doing research. And other HTAs that have been done have had 200-300 research articles. We had over 25. We had over 2,600. So the HTA has a very strict format that we had to follow, and I believe we are the only profession that has ever defined itself through surveys. And the other thing in the HTA, anything we wanted to say, we had to prove through a survey. It had to be research-based. So even though we know, for example, that naturopathic doctors globally prescribe or use more than one therapy in a treatment, we couldn't say it unless we had research. So we did an international survey per practice and that sort of thing. So every single thing that we've said in the HTA had to be research-based. The other thing that we did is almost every chapter was done as a research article that was published before it was put in the HTA. So we have those layers and layers of research credibility behind it. We had over 51 contributors to the HTA. Amy Steele, myself, and John Wardle were the editors for it. And it surprisingly came together well. And a part of that was Amy and I had a lot of early morning and late nights because of the difference between Australia and Toronto meetings. And we both have a great work ethic. So for us to be able, the WNF was formed in the fall of 2014, and for us to have an HTA done in 2021, that's quite amazing, actually. So, and it really was even the surveys that we've done, every survey that we've done has been volunteer and that sort of thing. So this is truly a gift from the profession to the profession. And it will allow countries that are going after regulation and who should be regulated, like Australia, countries that are going after regulation to really defend, and for countries that are brand new to it to really get to really help them jump ahead really quickly, because it is written for government and for practitioners, because it says anything you want to know about the profession, this is what it is, and everything is research based. So it was a great exercise, intense work over a very, very short period of time, but that's the only way something like this gets done. And I'm just really thankful that we had all the volunteers that helped, and I'm really thankful for the other co-editors that worked with me on the project.
I guess, you want it relevant and up to date, and you have to squeeze that in. Otherwise, it gets too drawn out, and then right. So it's really important that it happens in that time, which is a huge effort. Wow. So from that, what's your reflections on obviously you said that, we fared well, very congruent across, multiple countries, which is amazing. Where do you see almost the lack, or what needs to change, compared to certain countries, and how do we need to conform better or regulate better? Where does Australia fit in? Where does America fit in? Where does Canada fit in? How do they compare?
So our next step in the WNF in the profession is a couple things. We've realized we've done 5 different surveys on education. There was the understanding that the naturopathic profession has diversity in education around the world. But what we have found, hang on one second. What we have found is there's really 2 programs that are emerging. There's a 2,500-hour practitioner program and a 4,000-hour doctor program, which is very similar to Chinese medicine, very similar to Ayurvedic medicine. So the goal is to help those programs that are under 2,500 hours get up to 2,500 hours, because no health profession is regulated under 2,500 hours. And to be a member of the WNF, you need to support regulation, because regulation is how we ensure we protect the public, right? So we are working with schools to help them do that. That'll be a focus on the General Assembly that we have in September. So we have that piece of it. So it's not about standardizing naturopathic education, but it really is about recognizing we have two programs and working to those two programs, with each country choosing a program. So we don't want Canada, we don't want Australia saying we do both. It really is, if you're doing a doctor level program, you do a doctor. In some countries, based on regulations, they can't do the 4,000-hour programs. So then they will do practitioner. So part of it is that is the next step. Part of it is what we call metrics. One of the things we have found from doing the HTA is what has hurt our profession is even practitioners have a lot of misconceptions as far as how much research there is, where the naturopathic fits in traditional complementary and integrative healthcare globally. And when we go through the list, like right now, we're making a list of how many naturopathic researchers are there globally. And initially people were saying, I think we're going to have about 80 or so. Well, we have over 350, right? So part of it is when we're looking at how many research centers we have, how much funding have we had for research? So what hurts the naturopathic profession the most right now is that people don't know what we call the metrics. They don't really know, where do we sit on this, right? Mm-hmm. So our focus, the WNF's focus, is to help countries with that and to help build research capacity globally. And part of the reason why it's important to build research capacity is because with the new traditional medicine strategy from the WHO that is being produced, because the current one expires in 2023, they have modified the wording to say that those professions that are researched are proven by research to be safe and effective will be regulated. So with that new qualifier, there is even more importance. And part of like the biggest issue we have in the profession, which is in many professions, is what is called knowledge mobilization. There is a lot of research being done, but a lot of naturopathic doctors don't know the research, right? So then you have this lag time between whether it be the mechanism of action of ginkgo, for example, or whether it be further update on systems theory. Right. So we have this whole thing, like you had said before, the world is moving so quickly. And with that, the whole idea, what will determine the ease, I'm going to say, for the naturopathic profession moving forward is our ability to figure out knowledge mobilization. How do we ensure that the naturopathic doctors around the world, the 60, 80,000 naturopathic doctors around the world, keep up to date on the research that is there? Because if not, you have a lot of researchers redoing the same, right? And you have it where the ability, even if you think of like Germany and India do the most research on hydrotherapy. So if somebody wants to say, what is the new research on hydrotherapy and how do I explain that? It's like, you need to know where to go, right? So that's our job right now. Is we know that the profession can present itself as a single profession is moving forward. Now it's a fact, there is so much information. When I was a student, the question was, how am I going to find new information? Now the question is, I can't read all of this, like all of the research that I get on a daily basis. It's like, I read a lot of research, but it would be a full-time job. So we have to figure that piece out because there is so much knowledge, and we have to be much better at, when people say it's not research-based, saying that might have been true 30, 40 years ago, but it's not true anymore. So a lot of naturopathic practitioners are behind in their thinking as to where the profession is.
Yeah, which is nice to know, that we've dived ahead and we're still thinking that we're not even there yet, which is actually right. a good thing in a way. But how do we globally, like you say, mobilize this information and make it accessible at the current rate that it's being produced? Because with any profession, I believe with the conventional medicine as well, it's that lag time. It's almost 10 years in some cases for some information from the research, and that's detrimental to the public. So needing to know this information.
Even when you talk about, when you mentioned initially about patients thinking that naturopathic is woo-woo, there is a small group of patients that do, but the majority of patients, I think, it's about recognizing we are talking to the patients that are already aware, right? You're always going to have this, but the whole thing is that it's about staying in that path and looking at the fact that says there's always going to be people who don't know, right? Just as there is for, I had somebody the other day says, what does an occupational therapist do? Well, how long have they been around, right? So you're always going to have people who don't know. But for what I would say to naturopathic practitioners, trust me, pretty much around the world, if you present what the naturopathic profession is, the patients are on board and the patients are already mentally there. So it's about it's about really staying in that lane. And when people think, oh, we still need to educate them and stuff like that, it's like, I would disagree. I would disagree. If you simply promote what the naturopathic does, people recognize it as that's what they're looking for.
Yeah.
Right? So it's,
isn't it? And it's also enabling confidence in the practitioner, so it maintains, they are seeking, clients are seeking it out. Absolutely.
Right. Yeah.
Yeah. Dr. Iva, I don't want to hold you any longer, but I could talk to you all night. So let's just finish up. And we always ask this, and then I want you to tell me a little bit more about where to find you, what we can do, and what else you've got going on in the near future. But what are some of the things that you say? And I know that it seems to be very hard to answer this question, but a few things that you would say that you do that make your life or how you live smarter, not harder.
One of the things, so first of all, I would say one of the skills that I promote and that I learned very early is mindfulness and being very focused. So I am, that whole idea that says when you have a whole bunch of tasks to do the ones that you dislike the most first so that you're motivated to get the other ones done. But the other thing that I would say is from a practitioner point of view, I find that the practitioners that enjoy the profession the most are the practitioners that are involved other than just practice, on a board, doing things, because you have much more awareness. And that's what I'm saying is that when I think of myself and the number of people I've met, the different types of naturopathic practices around the world, and the more that I know, the more excited I get. So that is the fact that says that it is exciting to have that increased awareness. And for some people, it's like there are so many things, like there are specialty groups for pediatrics and for environmental. So but find something and add to your profession, and in whatever way works for you. And the other thing is, I'm going to say, live the principles. Like if we're looking at where I would say that my life is, and this is something my family will say about me, is whether it be energetics, where I say everything makes sense, you need to figure it out, and trust the universe, trust your body. I live it. So it's not like this is me at work and this is me at home. It's the same. It's the same. So, and when I say to people, when you can really demonstrate that, and when that is something that you just, like in my clinic, I had a third generation traditional Chinese medicine doctor, and there was no separation between who he was as a person and who he was as a practitioner. Like it just exuded out of him, right? And that's what I'm saying is that when you practice and it's part of your life, that's when it's so much easier.
Absolutely. 100% agree. And I think we have so much in common. The more you speak, I'm like, yes.
Yeah.
But absolutely, like I think the passion comes out of you so much more naturally if you in every part of it. And it's so exciting to see all of these things happen. Every day I'm so excited. I say to my team, it's like always bouncing off the walls. Oh my God, this is herb, and I found a new one, and this is so good. It worked. We had success today, and that's the key to be a good practitioner is have that excitement. People feel it then. Absolutely, I love that. So what's next for you, Dr. Iva? What have we got coming up? Any events? You mentioned an event to global mobilisation, so that's in September, I think you said.
We have the World Naturopathic Federation General Assembly in September. The WNF participated in civil society organization meeting with the World Health Organization, So we had a 90-minute dialogue with Dr. Tedros, and I was fortunate enough to co-chair that. And then which was very good. And what I say to people is that when the WHO starts having a big focus on traditional complementary and integrative medicine, we need to be part of the conversation. So the WHO is having its first global summit on traditional medicine in 3 weeks. John Wardle is speaking at it, I believe. And if my visa comes through, I'm going. So part of it is that says that my job with the World Naturopathic Federation, figure out where the important conversations are and making sure we're part of it.
Yep.
So that's what we're doing right now, whether it be antimicrobial resistance, non-communicable diseases, environmental health. It's like if the naturopathic profession, if that's an area that we are leaders in, we need to have a say. Mm-hmm. So it's about, figuring out the areas, ensuring that we're part of the conversation when it's relevant.
Yeah, absolutely.
Something little like that. Yeah.
Yeah, but it's huge, isn't it? To be present
Yes.
at things and to be a part of that means that you care, and also you want to be moving it in the right direction. So it's huge, really, but it is quite simple.
It's huge.
Yeah.
Mm-hmm. Yeah.
Incredible. Well, thank you so much for your time. I absolutely great of a conversation. I love spending this time with you. So, thank you so much, Dr. Iva.
If it ever comes up again, invite me back. You take care. Thanks.
See you later. Bye.
Okay. Bye-bye.
Thank you for joining us on another episode of the Smarter Not Harder podcast. We are incredibly grateful to Dr. Iva Lloyd for sharing her expertise in the world of naturopathic medicine. If you found today's conversation valuable, we kindly ask you to take a moment to leave us a 5-star review on Apple Podcasts, Spotify, or your preferred listening platform. Your feedback and support mean the world to us, and it helps us to reach more curious minds like yours. And don't forget to subscribe to our YouTube channel to stay updated on our latest content. We hope that this episode has expanded your understanding of patient-centered care, the global landscape of naturopathy, and the transformative power of holistic approaches. This episode leaves us with a deeper understanding of health care. As we wrap up this episode, remember that knowledge is power. We're committed to bringing you 1 cent solutions to those $64,000 questions, and we appreciate your continued support and curiosity. Thank you for tuning in to the Smarter Not Harder podcast. Stay curious, keep learning, and we'll be back soon with another insightful episode.